I move on to psychological therapies. Initially, earlier there was this, we felt that psychotherapy is only for depression or anxiety. A patient with schizophrenia can never be able to engage in any kind of therapy. But that's wrong. And increasingly, again, new research has shown that both individual and group psychological therapy can be useful in addressing the impact of the illness. In particular, cognitive behavior therapy has been shown to be useful in addressing some of these unhelpful patterns of thinking and behaving when they feel everybody is talking about them, the whole world is against them. We kind of gently challenge these beliefs and make them show, get them more into reality, thereby reducing the severity of the psychotic symptoms, both the positive and negative. And I think the most important is when we are looking at functionality is really the rehabilitation. And I think at IMH we have a very big occupational therapy department. In the past, all the patients with schizophrenia used to go to workshops, structured workshop where they used to stamp things, paste, make envelopes, etc. But what we find is that increasingly it's not that you have to place them, you have to train them and then place them in work. You place them in work and then you train them and support them over there. So this is what we call as supported employment. And that has shown that it increases job placement and tenure rates. So psychiatric rehab programs are very, very useful in enhancing the vocational skills of patients with schizophrenia. Schizophrenia, as it's a brain illness, it affects our cognitive functioning, especially working memory, executive functioning. It's not as severe as in dementia, but it affects our higher level of functioning, like the way individual plans things, makes decisions, multitasking. All these skills are affected. And unfortunately, our medications, the antipsychotic medications, don't work very well on these cognitive deficits. There are new medications in the market which are really in the research phase. But what has shown to be effective is what we call as cognitive remediation therapy. These are computer-based training programs where the individual sits and it helps them. It's almost like a memory games. It trains them. You play it again and again and again to improve your memory. But what research has shown that these kind of cognitive remediation is more effective if it's provided within a framework of psychiatric rehabilitation program. So what you do is you have a patient doing this kind of remediation therapy and then is also kind of, practicing this in a real life setting. And that is where they can apply what they have, the skills that are improved onto real life setting, and this is where it works. And that has shown to really be effective in improving patients' cognitive skills and also improving functionality. Unfortunately, there may be patients who don't do too well. They may not take their medications because of poor insight, poor family support, and sometimes have repeated hospitalizations into the hospital. And over here, what has been shown is that assertive community treatment, which really consists of case management and community-based interventions given by a whole team at the patient's homes. They are effective in reducing relapse rates and rehospitalization rates. We have a whole new chapter on schizophrenia and pregnancy in this CPG, because we find that as patients with schizophrenia, we can kind of, get them to function better. They have better rates of recovery. They do get married, get pregnant, and we need to address if our patients get pregnant or want to have babies, they need the proper care. So later, Dr. Helen Chen is going to talk on this very important aspect of managing patients with schizophrenia. I think Dr. Chua kind of touched on this, because we find that many of our patients who recover are very stable, and they really don't need to come to a specialized center to pick up medications. And because of that, when we thought about it, we launched our GP partnership program about 5 or 6 years ago to really train a group of GPs to manage our stable patients who are working, who are functioning, who don't like coming to a specialist care, to be managed by the GPs. So I think it's been hugely successful. It started off at IMH, but now it's an MOH initiative. And as Dr. Chua said, we have referred more than 1,000 patients to the GPs. And this also led to the graduate diploma in mental health, where we have a whole module on psychosis. We teach, I think there are 4 didactic sessions, but also attachments to the Department of Early Psychosis Intervention. And we really kind of talk to or train our GPs in managing these stable patients with schizophrenia. So I hope that, I'm not sure how many of y'all are already in the GP partnership program, but if you're not, it's something that, and I think these guidelines should be useful in giving you all the confidence in managing patients as well. And I think there's a whole thrust in community psychiatry, and we cannot really do without our partners in the community. Psychiatric patients really need a voice in the community, and that's where we have our VWOs who really advocate for our patients and work very closely with our patients to kind of help them reintegrate into the society. And today we have Ms. Poshpo, who's going to, she is the director of Silver Ribbon Singapore, and she's going to talk about mental health advocacy for schizophrenia in the community. I think that's all my talk today. Thank you so much. I think later on we'll have the Q&A, so you can keep your questions for later. But it gives me great pleasure in introducing my next speaker, Ms. Koo Chai Ling. She's a senior clinical pharmacist at the Institute of Mental Health. Chai Ling is board-certified pharmacist, and she's very experienced, and she's really helped us develop the medication module for this clinical practice guidelines. So Chai Ling, over to you.